Hi, I'm Dr. Christopher Kawa. Thanks for watching. Did you know that people with the highest cholesterol levels live the longest? Let me repeat that. People with the highest cholesterol levels live the longest. Now, I know that statement seems diametrically opposite of what we've all been told for so many years, and it's hard to believe, but there are many studies, and I'll go over some of them, that show just that. One such study was out of Yale University, and it started the whole doubt about cholesterol's impact on heart disease, and it dates back to 1994, when a Dr. Krumholtz from the Department of Cardiovascular Medicine at Yale reported that older people with low cholesterol levels died from heart disease twice as often as older people with higher cholesterol readings. Yeah, it's hard to believe, but the studies show it. And there are many more recent studies that support this hypothesis. Most studies of older people have shown that high cholesterol is not a risk factor for heart disease. And you may be thinking, well, my doctor tells me it is. Who should I believe? But this is straight from the Medline database from studies that address this question. In fact, according to one cholesterol researcher, Dr. Ravnikoff, he's an MD, PhD, he looked at many studies, and 11 of which showed that older people who had higher cholesterol levels did not have an increase in mortality. According to Dr. Ravnikoff, more than 90% of all cardiovascular disease is seen in people over 60, and almost all the studies have found that cholesterol is not a risk factor at all, especially for women. There were 6 studies that showed that total mortality was inversely associated with total or LDL cholesterol or both. This means that it's actually much better to have higher than to have lower cholesterol if you want to live to be very old. Now, it wasn't long ago that cholesterol levels of below 250 were considered normal. And then slowly but surely over the years, researchers that have direct ties to the pharmaceutical companies started lowering the guidelines. And the interesting thing about this was that there were no research studies to support lowering the guidelines. So they lowered the threshold so much so that in 2015 they lowered it down to 180. And overnight, in 2015, 15 million more Americans went from being perfectly healthy people to patients of the cholesterol medical establishment. But what most doctors don't tell you is that statins, these cholesterol drugs, increase your risk of diabetes. They denature a protein in your brain called tau, T-A-U, that's essential, and it causes dementia. And that people who start taking statins get statin-induced hepatitis within 1 year. Half of them do this. That means their liver is being damaged. The truth is that cholesterol is one of the most important chemicals in your body, and it makes up the cell walls of every one of the 70 trillion cells you have in your body. It's crucial to your existence. But somehow, medicine and big pharma have convinced everyone that cholesterol is an evil menace. Now, for example, it's been shown that higher cholesterol protects against infection. There were 19 large studies of more than 68,000 deaths reviewed by Dr. Jacobs from University of Minnesota. And he found that low cholesterol predicted an increased risk of dying from gastrointestinal and respiratory infections. And here's an interesting fact too. When you're exposed to sunlight, UV radiation causes cholesterol to convert to vitamin D. That's how we make vitamin D in our bodies. And this is strongly tied to preventing cancer. So I strongly recommend you researching this. And one of the greatest books, I think, is a book called The Great Cholesterol Myth, subtitled Lowering Your Cholesterol Won't Prevent Heart Disease and the Statin-Free Plan That Will. So those with vested interests, namely the drug companies and executives and the scientists who are tied to the industry, have done a really good job of confusing people about what normal cholesterol levels are. And they've created a huge amount of unnecessary fear about cholesterol solely for the purpose of turning healthy people into patients. And I hope and pray that you are not one of them. Thanks for watching. Talk to you soon.